Okay, I think IT has mine up now, correct? Okay. Just a point of interest, this is our 70th week of presenting this data report. I took a look back at that as I was getting it ready, as it seems to become part of our permanent life. Taking a look at our cases and testing, we need to focus in on the right-hand part of the slide and share some information that actually came to light last week when we didn't have a public presentation of this data due to the Thanksgiving holiday. And what happened is there were some big adjustments that were made about cases by Department of Health and how it was reported. We've now become compliant with the national standard that reports a second positive test of COVID 90 days after the first positive test, which caused this dramatic increase in our slide, in our exhibit 2 weeks ago. And what that has caused is kind of a 14-day period of time where we really didn't understand what our quote unquote new normal was with respect to cases. But we've now rolled those out over the last 14 days. And where our case count is showing now is representative of where it looks as though we will be for the time period. Or for the time being, I'm sorry, which is somewhere in the neighborhood of about 200 reported cases a day. Approximately 60 to 90 cases a day more than what was being reported prior to the inclusion of these second infection numbers. So I just wanted to take a moment there and explain why the chart looks a lot different. Another slide that we began incorporating last week, which the public is only seeing for the first time this week, is kind of the national overview from CDC of where counties are with respect to case rate. And this week actually shows some pretty good news, which I circled in red there on the right-hand side of the slide. We see that a fairly significant number of counties, particularly in the South, have dropped into the low community transmission. Unfortunately, that hasn't benefited us here in the northeastern United States. We've remained optimistic for the last few weeks that we would start to see that change in community transmission, but the Omicron variant, which we're going to talk about in a little bit, and I'm sure everyone has heard about already, is likely going to mean that that's not going to be the case, but still much to be seen. Our pediatric cases in the county are kind of hovering around where they have been. Clearly, the graphic shows an increase in the last week, but again, as far as more of a rolling average number over a number of weeks, we're pretty much in the same place we have been, in that 5 to 18-year-old range that is going up and down, and the 0 to 4 remains very level where it is, with approximately 50 cases over that period. Our hospitals are becoming more busy. Not surprising. We know that there's a seasonal aspect to the disease, and we expected to see this rising as we moved into the winter. Just to reemphasize for folks again, our big concern here is not only COVID, but COVID with influenza on top of that, as this will be the first influenza season that we're really experiencing with COVID, as last year was much of a wash due to the fact that there was almost no influenza due to the COVID mitigation measures. Our deaths have unfortunately just become a recurring theme, that there's not even a whole lot interesting to talk about. They just continue to climb and climb and climb week over week. We would love to get back to where we were over the summertime period, where we saw this very flat curve, but that doesn't appear to be anywhere in our near future. Much like cases a couple weeks ago, vaccines have had a significant change in the last week. CDC issued a major correction on vaccine statistics for a number of states, Pennsylvania included, and Berks County, like all other counties in the state, was part of that. Really what it did, and CDC called this a data correction. There was a fairly informative article published in the New York Times about this that explained what was going on, but it had to do with a data cleanup at CDC where they were overstating numbers due to methodologies of reporting, and they had statisticians go back and clean the numbers up. And it really took us back as far as the number of full vaccinations administered in Berks County, took us back to our first week of August numbers, as though effectively no progress was made between then and now. Now, the reality is we don't know when the erroneous statistics got into the numbers, so I don't think it's as simple as saying nothing happened since August 1st. Clearly, that's not true. But from a data perspective, our numbers are back where they were in that first week of August. This also leads us to be unable to project our real percentages with consideration to the one-dosers, because all of that data is calculated based on a longer-term evaluation of the data. So we basically have to wait for 5 weeks until we have clean data that we can again use to reevaluate those numbers. As we have for the last couple weeks, taking a look at the influenza graphic, we saw an interesting drop downward a couple weeks ago that looked like at least one data point of good news. Unfortunately, that is now right back up where it was previously, as cases that were not yet factored into the numbers ultimately got factored in. And again, on this chart, we're going to focus on the left-hand side. The red line with the circles are our influenza cases this year, and you can see that we're starting very early. Now, I want to point out that starting early doesn't necessarily mean things are going to be really bad. It could just shift the graphic to the left. But I will point out that we're on an upward rise much earlier in the season than we generally have been. The only other example of this is the 2019-2020 year, which is the gray line, which the red line is almost following. So, we want to see that number stay very shallow or as flat as possible, keeping the cases on a weekly basis down near zero, helping our healthcare facilities to not be overwhelmed by that combination of COVID and influenza at the same time. We don't have anything to show for the BerksCares clinic due to the Thanksgiving holiday and the fact that that clinic is operating on a Wednesday through Saturday. They did not administer vaccine last week, so those numbers are zero. Our CDC vaccine recommendations remain unchanged by age group with respect to what is available, but we do have some new information on who should or may get the vaccine. And this slide has finally gotten simple after CDC has now made their recommendations much more simple. And the answer for boosters is if you are under 18, there are not boosters currently available. And if you're over 18, finally, we're at a point where the recommendation from CDC is consistent among all age groups, all vaccines, all people. If you are over 18, it is recommended that you should have your vaccine boosted 2 months after Janssen or 6 months after Pfizer and Moderna. Just quickly, some current events or items on the horizon. The Merck antiviral drug Molnupiravir has been reviewed by the FDA. Is being reviewed by the FDA with anticipated approval this week. 2 days ago, I believe it was, or yesterday. I apologize if I don't recall which. The FDA advisory panel recommended approval to the FDA, but that is an independent advisory panel. It is not the FDA approval, and we would anticipate that this drug will be reviewed and approved sometime this week yet. Just a couple things to point out that the advisory panel did narrowly recommend the approval, and this is some interesting reading if folks care about this kind of stuff and have an interest in these breaking technologies and treatments. There appears to be a lot of concern about this drug and the way that it works and its ability to alter the genome of the actual virus and potentially drive other mutations of the virus. So I believe that they're trying to balance the benefit that it may bring for those who have COVID and are attempting to avoid significant illness against the public health impacts of the use of the drug. So I'm certainly not a public health expert, but as I said, it is some interesting reading for those who are inclined to go and pursue that. The similar antiviral by Pfizer is still under review and evaluation, and I say similar, although I'll point out it works in a different way and doesn't bring that concern that the Merck drug is bringing among some people. So more still to learn about the Pfizer antiviral. I guess the big news over the last few days to a week is the COVID variant B11529, which we all now know is called Omicron. A lot of very concerning reports about transmissibility here early on. Although on the good news side, it sounds as though the information that we're getting out of South Africa, where the most is being seen about this illness, is that the severity of the illness of those who are infected is not dramatic. So it appears as though it spreads very easily, but those who get the disease don't become terribly ill in general. Of course, there are always exceptions to those rules in all directions. I do want to mention, though, that we can't lose sight of why transmissibility is important, even if severity of illness remains low. And that is very simply, where did Omicron come from? It came from people who were getting prior variations of the illness. And every time COVID is infecting someone, in essence, the person becomes a petri dish within which the virus can again mutate. So, I've even had discussions with my friends and family members who say, well, this looks like it's no big deal. Okay, there's more of a chance I'm going to get the illness, but I'm not more likely to get sick or die. And there is still reason to be concerned. Granted, on an individual level, we're all very concerned about, getting sick or dying, but on a larger community or global scale, we do need to continue to be concerned just about people getting the disease. And we hope to know more about the efficacy of the vaccines and how they impact this new variation of the illness within the next 7 to 10 days. I also just want to mention that there is a public health or a public testing opportunity here in Berks County in cooperation between the county along with the Pennsylvania State Department of Health and their contractor. That is actually being conducted here at our operation at 2561 Burnville Road as a drive-through opportunity on Tuesdays through Fridays from 10 o'clock in the morning until 7 o'clock at night, and Saturdays from 9 o'clock in the morning until 3 o'clock in the afternoon. And that testing opportunity will continue through December 11th. Just a quick overview of your best access when you're on 183 outside of our facility. If you go down Van Reed Road and follow that red arrow and go into the parking lot where the red arrow shows, that's your best approach. There is signage all around, both lighted signboards as well as static, just kind of signs, not cardboard, but you get the gist. A paper sign that is available all around the intersections around here that help to direct people in. I don't think folks will have any problem finding it once they get in the area here of 183 and 222. And to wrap it up, just kind of a commercial for our doyourpartberks.com website, where you can find a lot of information about COVID as well as vaccine, and also testing information inclusive of the one we just talked about, as well as other testing opportunities here in Berks County. That's all I have, Commissioner. Back to you.